Here at the treatment center, we're asked a very common question: what about dual diagnosis or about comorbidity? What that is when there's two or more issues in the same patient at the same time. And we have different experts. We have therapists, psychiatrists, psychologists, and the like, and we have a plethora of other personnel that help us with these different areas. Of course, we have drug and alcohol focus here with rehabilitation thereof, and we also have psychiatrists and psychologists and therapists and counselors to help people with other diagnoses. Now, sometimes these other diagnoses come as a direct result of the progression of alcoholism or drug addiction. In other words, a person starts to feel restless, irritable, and discontent, and as their addiction grows, these symptoms get far greater in magnitude, and these symptoms can become an incredible obstacle to early recovery and create such an obstacle that relapse is very common if you don't deal with these things. A second area where we deal with this issue is where there are comorbid diagnoses. In other words, there is an alcoholic who has a diagnosis of depression or anxiety or panic disorder or bipolar or whatever, and in those cases that person needs not only the treatment for addiction or alcoholism and the rehabilitation thereof, but also needs their comorbid diagnosis or their dual diagnosis addressed. There are also several other compulsive disorders such as eating disorder, gambling disorder, sexual addiction, the list can go on and on, that also coincide with either drug or alcohol addiction. If you just focus on one addiction with the ignorance to the other and leave those on the side, you might get a person to stop drinking and drugging for a while, but those other issues, if they're left unattended and undiagnosed and untreated, can be such a problem in one's life that they eventually go back to the drink or the drug. So we at the treatment center, we address the full patient. We address all their issues. We address their emotional issues. We address, of course, their physical addictions, as we discussed, and we also address their spiritual development or bankruptcy, in most cases an addiction, and we try to take the person as a full, total person and see what other things they have going on. So in that effect, we treat each patient individually, and that gives us a much better chance of achieving some long-term sobriety. My name is Adam Bianchini. I'm a medical doctor here at the treatment center in Lake Worth, Florida.